everyone. Good afternoon, everybody. I'm Priyanjali, your host for today's live from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. Today, we are going to discuss about a very important topic about our skin health, of course, with focus on urticaria or hives. What we or our near and dear ones might have faced at any time in their life. Urticaria is characterized by round rash on the skin that's itch intensely. It may be due to chemicals in certain food, allergy to certain medications, insect stings, sunlight, and sometimes the cause is unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of the patients are in the age group of 20 to 40 years. Incident is higher in older age group. Urticaria is classified as acute and chronic. But the most important part is not to ignore it, and doing self medication can worsen its symptoms. Consult your nearby dermatologist or qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of tests required for its diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist of India, Dr. Omkar Warang, is an MBBS, DDVL, DNB, Dermatology and STD. He is the director of the Hair and Shape Clinic. He is a board certified dermatologist over 7 years of experience in dermatology and hair transplant. He's trained in dermatology and venereology and earned a Diplomat of National Board DNB degree, and his skills and compassion has made a tremendous difference in patients' life. A very warm welcome to Dr. Omkar Warang. It's a pleasure, Doctor, to have you here with us today. And we are going to discuss about a very important topic, as said, which is the management of urticaria. So, first of all, we would like to ask you, what is urticaria?
Okay. First of all, thank you, Priyanjali, for the introduction. Yeah. Hi, guys, there. So, when you talk about urticaria, it's a kind of an allergic reaction, or it's an allergy, skin allergy, to be specific, type 1 hypersensitivity reaction, right? And how does it occur, or what is it called in the common language? We call it hives. And what are hives, or how you define urticaria is it's either associated with wheals and or angioedema. Now, when I say wheals, what are wheals? Pale red or bright red structures will be present over the skin, and they might be a bit elevated, right? And when I mention angioedema, you might have swelling over the face or the lips or the oral mucosa. That's how an urticaria usually presents.
Right. Now, identifying a disease or a condition becomes a challenge for all of us, doctor. So, how does the initial stage look like? Is it always a round rash, or it can also look different in different cases?
Right, right. So, in my practice or in a day to day basis, what we commonly see are physical urticarias. Okay. Now, in physical urticaria, it's quite easy to demonstrate that the person or he or she is suffering from urticaria, right? There is a term which we call as dermographism. Now, in that, what does it happen is, suppose if I am to just, do fingers, place my fingers like this on a person's hand or on the back,
Mm-hmm.
my fingers will be seen over the person's back, right?
Okay.
And that is called as dermographism, and that is commonly seen in many individuals.
Right. So, are we saying that the skin becomes sensitive that such characters can be seen?
Right. So basically, those patients they suffer from type 1 hypersensitivity, right? And there is accumulation of mast cells, right? They get accumulated and they get activated,
Mm.
and as a result, the
Mm.
skin becomes more susceptible to these physical insults. I would say, you know.
Right. Right. So, how does the lesion normally look? Because I personally, in our life, we have seen a lot of lesions happening on our skin, the skin being the largest organ. So there are a lot of things happening almost every single day. So I personally have seen lesions like insect bite or mosquito bites, as we say. There are round or irregular shaped lesion on the skin, which are normally a little, what do we call that? Normally a little just like mosquito bite, how it looks. So are
Correct.
those
Right.
things
Right.
also urticaria? We also have seen people who are used to wearing tight clothes. So there are red marks or lesions occurring in such scenario as well. So is that also urticaria?
No, that does not see. Now, there are various types of urticaria. Okay, there is a condition
Hmm.
called as papular urticaria. Even though the name is
Hmm.
papular urticaria, it might look like an urticarial lesion, but it is not urticaria. That is usually seen in insect bite reaction. Okay, and seen in small
Right.
kids over the exposed areas like the arms, the legs, which are not covered by clothes. Okay, and
Right.
papular urticaria, a lesion might disappear and a new lesion might appear. That is a classic history that
Hmm.
parents usually give about their child, right? They come to me saying, "Doc, पहले ये आया था, फिर वो चला गया, फिर दूसरा आया." So that is papular urticaria. Okay, that is different. That is insect bite reaction. When I'm talking about chronic urticaria or say acute urticaria, the patient complains of मेरे body पे सर अचानक पूरा ऐसे लाल लाल हो गया था. That is the usual the
Hmm.
words that my patients use.
Yes, doctor, we will continue with the same question. Now, as we know that the causes can be huge when we are talking about urticaria. We never know what is the cause behind it. But normally, according to your experience, what is the most usual cause of urticaria?
Right. So, food-induced urticaria is what I
Hmm.
see in my patients. Most
Hmm.
probably, कुछ खट्टा खाने से, कुछ that is what they usually complain of, right? That is the patient's perception, right? But many a
Hmm.
times, food is not the only culprit. Okay, it could be an environmental trigger. So usually, what I ask them is, कहाँ घूमने गए थे क्या in the past week or so,
Hmm.
or just
Hmm.
even a day back if they went to some new place which must have triggered their urticaria, or even an insect bite in some cases, right? So these are the common triggers. And the physical urticaria, which I was talking about, that is most commonly seen in school going children or those adults who carry heavy weight over their shoulders, right? And that urticaria is kind of usually seen everywhere.
So, doctor, another question I think which all of us would want to know, because we are talking about skin and we become very conscious when any lesion or any allergy occurs in our skin, thinking that it might be contagious. So, is
Mhm.
urticaria contagious?
No, urticaria is not contagious. Okay, so that fear should be out of your mind. Okay, it is
Hmm.
a type one allergic reaction. Probably tomorrow
Hmm.
even I might suffer from urticaria, right? So family history is kind of important. Like not all urticaria cases have family history, but if anyone in the family has urticaria, there is a likelihood that he or she might have another episode of it.
Right, right. Uh, we were talking about the food-induced urticaria. Yes, you were
Right,
mentioning
right.
कि खट्टा खाने से
So
कभी हो जाता है.
in my practice, there was one guy who had mentioned कि अखरोट walnut खाने से he used to get urticaria, right? The
Hmm.
other had mentioned prawns or झींगा मछली. So these are tomatoes, in some cases, right? So in such cases, if you avoid the trigger, if you avoid the
Hmm.
culprit, then you will
Hmm.
not suffer from urticaria. So that
Right,
kind of helps. Then there was
right.
another patient of mine who had exercise induced urticaria. Like we always recommend people to hit the gym to work out, but unfortunately, in my patient's case, the moment he used to work out, he used to have the hives or the wheals over his body, right?
Right.
So these
So,
are the causes. Yeah.
right, right. So, I think the biggest challenge here becomes to identify the trigger, because it almost becomes very tough for the people who are suffering from the condition to understand कि किस चीज से हो रहा है ये चीज. To make it easier for the people who are wondering कि कैसे समझे triggers, you need to visit an expert. Please visit your nearest expert. Share your daily schedule, whatever you're doing, and maybe your task becomes a little easy then. Doctor, how do we normally diagnose people with urticaria? What is the process? The first line.
Right. So whenever the patient walks into my chamber, I usually look at his skin condition. How what are
mm,
the wheels or how are they distributed? Usually, as you
mm,
mentioned, they're roundish. They could be serpiginous, like a snake-like. They could be coalescing. There would be multiple lesions present all over the skin. The patient complains of itching, right? Itching is
mm,
very, very intense, right? So that is the prodromal, that is the significant feature of itching over the skin, right? And multiple lesions present all over the body. Also, if it is acute urticaria, they will say that the lesions have occurred just a day back or a day before. So it's a very short history, right? And there's a clinical term which you mentioned, that blanching is seen, as in if there is a lesion over the skin, if I have to press over the lesion, right, the color will become a bit light. So that is called as blanching, and that is usually seen in urticarial cases, right?
right. Now, let's know about the treatments which are currently available. We know that medical science had evolved drastically in the past few years. So, currently, how do we normally treat patients with urticaria?
Right.
Apart from avoiding the triggers, of course.
Yeah, so obviously, first I say is prevention is better than cure, right? So if you avoid the
Right.
trigger, if you know that this is the trigger, just don't do it, right? But
Mm,
if it's something that you still haven't found out the cause and you need to treat it, so first and foremost are your antihistaminic tablets. Okay, we usually give it once in the day, once at the night, and even if the patient shows no relief, then we increase the dose, up to 4 times the initial one. So
mm,
that is one. Number two, we have injections available of monoclonal antibodies. In some cases, the urticaria could be autoimmune, right? In such cases, we need to inject, which is a monoclonal antibody that will act against those antibodies which are causing urticaria. The name of this is omalizumab, okay, the name of the injection.
mm.
And in certain resistant cases, we might have to switch to immunomodulators such as cyclosporine.
Right. For all the viewers who are watching us right now, we are sharing the processes, we are sharing the name of the medications, but please don't use it for yourself. Uh, One thing we can do is search the compositions, or Google them and know how they are useful for us. That's what we can do. And we should be aware of ourselves, irrespective of whomever we are visiting. You should know what you're eating, you should know what you're applying. But you are not supposed to use those by yourself. Please, 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 whatever you are doing to your health, whatever things you are consuming, make sure you are doing it under a expert guidance. Doctor, will quickly move ahead to the next question. We know that urticaria are of two types, acute and chronic. So, how does chronic urticaria differ from acute urticaria? This would be the first question. Yeah.
Right. So acute urticaria is an urticaria persisting with a history of less than 6 weeks. If a patient comes to me saying that he has been suffering from those hives for more than a month and a half, then I would classify him as a chronic urticaria. Okay. So it's
So,
basically based on the
can
duration. Yeah.
chronic right, right. So, can chronic urticaria be harmful for the patient somehow?
Harmful is a word I would not want to use. It actually decreases the
Hmm.
quality of life of the patient. Wherein,
Right.
imagining you're at your desk, you're working, and all of a sudden you need to just scratch your body. You're in the middle of a meeting and you need to scratch. That kind of becomes a bit uncomfortable for the patient, right? So it decreases the
Hmm.
quality of their life and it hampers their productivity.
Right. Right. Now, uh, as we know that there are a lot of causes surrounding urticaria, what is the most weird cause amongst them? We know that there is something called solar urticaria. I personally have met people who, whenever they come in contact with rain, they have such certain lesions on the skin. So what are these sort of I mean, how can somebody avoid the sun? How can somebody avoid the rain? So how do such people avoid the triggers?
Right, right. So there are various types of urticarias. Okay, so chronic urticaria can either be induced by physical factors, as you mentioned, solar or aquagenic, right? It could be cholinergic. When I use the word cholinergic, people who sweat complain of urticaria, right? So aquagenic, cholinergic, even contact urticaria. As a matter of fact, there are patients wherein I have just used the blunt end of my pen, and if I've just drawn a line over their hand, they complain of urticarial lesion. So in such cases, what I recommend people is wear loose fitting clothes, right? Or if you are having solar urticaria, try to wear protective clothing so that you do not get exposed to UV rays. In aquagenic urticaria, especially the ones housewives, right, who work in the houses, I ask them to wear Scotch Brite gloves, right, so that protects them for a certain extent. And a chronic inducible urticaria, the ones which all these factors induce, I ask them to have an antihistaminic tablet 20 minutes prior the exposure to the allergen. So if the patient knows that they're going to work in water or they're going to go out, pop in an antihistaminic and then move out. Of course, after consulting a dermatologist, just don't buy it over the counter. I'm not able to hear
So,
you.
so we know that urticaria is something which can occur on itself. And it also has a tendency that it can vanish on itself as well. So people who are wondering कि क्या हो रहा है, अपने से आ रहा है, अपने से चला जा रहा है, why do we need to treat it? So what would be the answer for such people? How long does it normally take for the lesion to disappear, and what are the potential complications if someone is leaving it untreated?
Okay. So urticaria usually presents for like 24 hours and then it vanishes, right? But when it
Hmm.
is reoccurring every other day, it really hampers the quality of life. So that's why I usually recommend patients to have an antihistamine with them in their bags or in their purse so that whenever they have an episode, they can easily take the tablet, right? Number
Hmm.
two, urticaria might persist for say 3 months, in certain cases 6 months, or it can go for beyond a year as well. So every
Right.
individual shows variation. On an average, if you ask me, a patient of urticaria probably has the lesions for at least 8 to 12 months. Yeah, that is the average, of urticaria being there. And there are certain patients like after a year and a half, it's completely vanished. So they need not keep their antihistaminics with them. So it varies
So,
from
so
individual
what
to
if
individual.
right? So, doctor, what if somebody is not treating the condition, thinking कि ये तो अपने से ही ठीक हो जाएगा? What can be the
Okay, so
potential complications?
that is something that I would never recommend anyone to do that because there is a life-threatening complication in urticaria which we call as
Hmm.
anaphylaxis or an anaphylactic shock. Now, what do I mean by
Hmm.
anaphylaxis? The patient finds it difficult to breathe, right? There is hypotension, the BP shoots down, okay? There is abdominal pain. So, all these signs are suggestive of anaphylaxis and they should get admitted to the
Hmm.
hospital at the earliest, right? So, that is a life threatening complication. So
Right.
please, everyone who's watching, please consult a dermatologist if you have any of these above features.
Right. Also, we know that stress is the reason behind a lot of conditions, a lot of diseases which are happening. If not the reason behind, it can somehow trigger any condition. So, doctor, can stress also trigger urticaria? We have heard of a term called stress-induced urticaria. So, how does it look like?
So stress is always an aggravating factor, right? The patient might be having physical urticaria. So even if he's wearing a bag which is quite heavy, he might not face the physical urticaria because of the bag load. But if the same person is under stress, under duress, and if he's in to come in contact with any of the physical cause, the person might suffer from urticaria, right? Say a delayed pressure urticaria, or say even a solar urticaria. So stress has
Hmm.
always been an aggravating factor. It will aggravate the underlying cause. That's how
Right.
it appears.
Right. Same goes with people who are suffering from diabetes. So we normally get to hear nowadays, previously there it was because diabetes शुगर की बीमारी है. तो शुगर की बीमारी है तो सबको लगता है कि शुगर ज्यादा इंटेक करने से ही होता होगा. But nowadays, because because of such platforms in our social medias. We know that stress is one of the reason behind diabetes as well, and we know that doctor, diabetes is something which can worsen any sort of condition or any sort of disease. It can be a little tough for such patients to get cured. So what about urticaria patients who are suffering from diabetes already? Does it look a little different for them?
Yes, for chronic diabetes patients with urticaria, the treatment goes on for a prolonged period of time, right? Because diabetes itself induces the body to stress, right? And that exacerbates the urticarial lesions. So for my diabetes patient who have urticaria, I give them tablets for a prolonged period of time, but they are mentally prepared. Like the tablets are going to be there, so eventually, once the sugars are also under control, the stress also gets reduced. Then I reduce the tablet load for my patients.
Right. Right. Doctor, moving in ahead towards the next question, we know that diet plays a very important role here. But apart from the triggers, are there any dietary precautions for the people who are suffering from urticaria? Any do's and don'ts?
So in general, I always recommend to have a high protein diet. A high protein
Hmm.
diet has always been beneficial in most of the conditions. So in high protein, if you're a non-vegetarian, eggs, chicken, fish are gonna sort out your issues. But majority of the Indian population are vegetarian. So in such cases, I ask them to take efforts to include protein in the diet. That will help not only for your skin but even for the hair and the general well-being, right? So I insist, I tell them to have more of paneer, more of soya bean, because Indian veg diet, to be frank, has very less protein in it, right? So I've always recommended to increase the protein intake irrespective of your condition.
Yeah. Now speaking of that, we know a lot of people who does not intake protein from the natural source. So either they'll take some protein powders, uh, any leafy protein powder, or any meat based protein powder. So how can a protein powder or such artificial proteins differ from the natural sources, or is it safe for people to intake any one of them?
So I usually recommend patients to stay natural, because we don't know what all
Hmm.
ingredients have gone into making that protein powder, right? Anything that is not being manufactured in front of us, I usually recommend patients to stay away from it. So try to stay as natural as possible. Eat more of eggs, more of animal meat. If that's not possible, eat more of paneer and soya bean is what I usually recommend.
So doctor, can having a low immunity also be one of the reason for urticaria?
Yes, yes. So in my practice, I have also seen patients having HIV suffer from urticaria. So hepatitis B, hepatitis C, HIV are also known triggers or known causes, rather than triggers, they're causes for urticaria as well. So whenever I'm evaluating a patient, I usually do ask about the sexual history, their history of travel anywhere, right? So these also play an important role.
Right, right. Now, moving ahead, Doctor, the next question is, why does it get worse in the night? I mean, a lot of people might be relating to this question, where the condition gets worse during the night. Also, it makes you very tired. So, what can be the reason behind it?
So basically, throughout the day, we are occupied with work. We have so many things going on. So many a times, the patient don't realize that they are having hives or the wheals or the angioedema, and that's why they didn't point it out. Once you are at home, where where all the work has stopped and you're relaxed, suddenly you notice those hives and you start itching. So the underlying condition is always there, but it gets aggravated in the night because your mind is pointed towards that condition, towards that itching, towards those wheels, right? So that's why there is this always a trigger saying, कि night में ज़्यादा हो रहा है. But by and large, even in the mornings, for chronic urticaria, the ones who are severe, even while they're working, they're complaining of itching over the body.
Right. But Dr. Tell us, can COVID also somehow cause hives on the face?
COVID has, like, in certain cases, yes, COVID has been the cause for urticaria. Again, because it's a
Hmm.
type 1 hypersensitivity reaction, and in COVID, the immunity is slightly on the lower end, it has exacerbated urticarial wheals, and in certain cases, even angioedema, wherein the lips are swollen, the upper body, the face has been swollen. So urticaria is a multifactorial disease, and stress or any type of body stress on exacerbates urticarial lesions.
Right. With that, I can see some questions coming up from the viewers. The first question comes from Pijushree, who asks, can food allergies cause urticaria?
Yes, yes. We, as we already discussed, food is
Hmm.
known to cause urticaria, especially walnuts in my patients. Again, when I'm saying particular food ingredients, it does not apply for all. Okay. So
Right.
what I recommend to my patients is maintain a diary, write a journal. कि डे वन को आपने क्या खाया, कहाँ क्या पहना, कहाँ गए, and accordingly, suppose if you suffer hives, say on day 4, so on day 3, you could just go through the journal, go through the diary, and rule out what
Hmm.
was done different from the previous day. Anything that is out of the ordinary could be the reason for your hives. So,
Right.
that is how I ask my patients to prevent it.
Right. The next question, doctor, comes from Anuj Kumar, who asks, how can stress affect urticaria symptoms?
Right. Again, as discussed, stress is a very exacerbating factor. It exacerbates whatever the underlying cause was. So if it's a physical urticaria or a food-induced urticaria or even, cholinergic urticaria, the stress can really aggravate those symptoms, and the patients have to, updose or increase the dose of the medicines they are on.
Right. The next question, doctor, comes from Sheila Agarwal, who asks, doctor, what is idiopathic urticaria? What is
Right.
idiopathic urticaria?
Right. So idiopathic urticaria is urticaria that I've seen in many of my patients, wherein those patients are not able to point out to the cause that is aggravating or causing the urticaria. Many a times when I say, maintain a journal and write down up kya kar rahe ho, kya kha rahe ho, it's not that easy. It's like easier said than done. You cannot document everything that you done throughout the day. So in such cases where they are not able to point out the cause for the urticaria, we label it as chronic idiopathic urticaria.
And the last question, I guess, comes from Devapriyo Sheikh, who asks, can medications like antibiotics trigger urticaria?
Yes, so drug-induced urticaria is very common, especially antibiotics, right? The sulfonylureas group, like they are the most common triggers for urticaria. So even in my practice, when I'm treating patients, I usually ask them a drug history. Wherein do they have any drug allergy or any symptoms when they have previously consumed the molecule and they have complained of any skin allergy. So that is always documented because I might prescribe a tablet to some patient, and if he or she has suffered urticaria previously, they might again suffer from the same condition. So it's very common, drug induced urticaria.
Right. Doctor, tell us, if avoided the triggers, can urticaria be cured completely?
Yes, in certain cases, yes. If you know that this trigger has caused the urticaria, and if you're able to
Hmm.
completely avoid it, definitely your symptoms will completely go down. But if you do come in contact with it, then again, you might have the hives.
Right. Well, we had a wonderful discussion on urticaria today. We got to learn a lot from you, doctor. Before we take a leave, any take-home message for our viewers who has watched us so far?
Right, right. So again, as I mentioned, maintaining a diary is the very important thing that you can do. Right, always jot down, whatever you have done throughout the day, and that can help you identify the trigger. Secondly, wear loose fitting clothes. Whenever you wear tight
Hmm.
fitting clothes, and as I mentioned, physical urticaria is very common. They can induce wheals over your body, right? Number three, what you can do is whenever you are having such an issue, please consult a dermatologist and get evaluated at the earliest. Do not let it harbor in your body, because you never know. In certain cases, urticaria might progress to anaphylaxis, and that's kind of a life threatening condition, right? And if you have urticaria, always keep a prescribed antihistaminic with you in your purse, in your bags. So, if and whenever you are supposed to face a flare up of the urticarial lesions, just have the tablet, prior 10 to 20 minutes, and then carry on with the work. That will not hamper your productivity, and you will feel happy throughout the day.
Right. Doctor, also tell us, how can self medication be harmful for the patients?
Self medication is really bad, and something I never recommend to my patients, right? Because you just cannot pop in a tablet just because वो डॉक्टर ने उसको लिखा था तो मैं वो खा रहा हूँ या खा रही हूँ, so self
Hmm.
medication will definitely land you up in trouble. So please consult a dermatologist, get it prescribed by the dermat, and then you can consume the tablet.
Well, that was the expert advice for today, and that was Dr. Omkar Warang for us. Thank you so much, Doctor, for your valuable time. It has been a very informative session for our viewers today, and I'm sure they will use this information to prevent themselves and their near and dear ones from getting urticaria. And in case they get to see such symptoms, they now know what to do instead of self medication. It's always better to approach a nearby dermatologist. It was great to hear from you, and we'll look forward to many more such sessions in coming times. Also, thank you, viewers, for your excellent participation. To get latest update on how to keep your skin healthy, do like and follow our Facebook page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.